do you actually use MUFA or would you use MCT? What is better is what she's asking. I mean, I think the question should be if the patient has hyperglycemia or is in glycemic variability, should you veer on the safer side by you veer on the side of MUFA, or should you give MCT? What's the answer in that? And I don't know whether there is a real answer to this, but maybe I'll
No.
ask Dr. Sanghabitra. Yeah.
Yeah, actually, it depends on the patient. Like, for instance, if you're dealing with a hepatic patient or a patient who has got liver impairment, where you cannot say increase the fat, but at the same time, the hyperglycemia is not getting resolved. So, what do you do if you have to restrict the carbohydrate of that patient? The best way to increase the fat would be to add MCTs. Similarly, for any hyperglycemic patient in the ICU, when we want to reduce the carbohydrate, but at the same time, we need to bring up the calories, that is a good idea when you use some supplement which has got a lot of calories through MUFA or MCT. That's the answer. That is how we manage. It's very, very patient-centric and very, very individualistic. We cannot say that, okay, this particular formula will work or this percentage we have to give. That is depending on the dietitian and her assessment of the patient. But these are the ways in which, by controlling even the carbohydrate, you can find ways of increasing the calories without increasing the blood sugars.
Correct.
Yeah.
So on a treatment basis,
I have to add something. Sanjay, I have to add something which is very important. It is a myth to say that there should be fat restriction in liver disease. The reason is the human liver does not have lipoprotein lipase, and the fat that is absorbed in the body is metabolized by lipoprotein lipase in the capillary endothelium. So in a fatty liver, that's a different situation. But just a blanket liver insufficiency, there is no reason why fat has to be restricted in liver disease, although it is a common practice, and because of culture, there is no evidence for that. Thank you.
Correct.
No, liver disease is a broad term. There are cases where there are malabsorption issues and the patient is not tolerant to fat. I'm talking about those patients. If they tolerate fat, then it's fine.
Yeah, I understand.
Correct.
GI tolerance, I understand. Thank you.
Correct. And if I would understand the question right, on a molecular level, would MUFA be better than MCT? Yes. On a molecular level, with respect to all animal studies, MUFA is known to be more scientific if it's more than 20% of the energy content, because it actually causes, as I said, an increase in peptide YY, increase in insulin, increase in GLP-1. So there are a lot of things that MUFA does, and that's the reason that most of these diabetic specific formulas would have an additional MUFA on top of the omega-3, omega-6 content that they have.